Arthritis is not just one disease. It's a term that encompasses over 100 different conditions affecting joints and surrounding tissues. More than 350 million people worldwide suffer from arthritis, making it one of the leading causes of disability globally. While many people associate arthritis with aging, the reality is far more complex. Understanding what causes arthritis is crucial for prevention, early detection, and effective management. In this comprehensive guide, we'll explore the 5 primary factors that cause or contribute to arthritis development. These causes range from genetic predisposition to lifestyle choices, and understanding them can empower you to take proactive steps toward joint health. One of the most significant contributors to arthritis is your genetic makeup. Research has consistently shown that if you have family members with arthritis, particularly first-degree relatives like parents or siblings, your risk of developing the condition increases substantially. Genetics plays a particularly strong role in rheumatoid arthritis, an autoimmune form of the disease. Studies have identified specific genetic markers, particularly the HLA-DR4 gene, that significantly increase susceptibility to rheumatoid arthritis. People carrying these genetic variants are up to 5 times more likely to develop this condition than those without them. Osteoarthritis, the most common form of arthritis, also has a hereditary component, though it's more complex. Multiple genes contribute to cartilage health, bone structure, and inflammatory responses. If your mother or grandmother had osteoarthritis in their hands, for instance, you're more likely to develop the same condition. Different forms of arthritis have varying degrees of genetic influence. Rheumatoid arthritis has up to 60% of the risk attributed to genetic factors. The condition often runs in families, and having a close relative with RA increases your risk by 3 to 5 times. Ankylosing spondylitis, an inflammatory arthritis affecting the spine, has one of the strongest genetic components. The HLA-B27 gene is present in approximately 90% of people with this condition. About 40% of people with psoriatic arthritis have a family member with psoriasis or arthritis, indicating a strong hereditary link. Genetics also influences how your body processes uric acid in gout. Some people inherit genes that make them more likely to produce excess uric acid or have difficulty eliminating it from their bodies. It's important to understand that having genetic predisposition doesn't guarantee you'll develop arthritis. Genetics loads the gun, but environmental factors pull the trigger. This concept, known as gene-environment interaction, means that your lifestyle choices and environmental exposures can either activate or suppress genetic tendencies toward arthritis. Epigenetic factors, changes in how genes are expressed without alterations to the DNA sequence itself, also play a role. Environmental factors like diet, stress, and toxin exposure can modify gene expression, potentially triggering arthritis in genetically susceptible individuals. Age is one of the most significant risk factors for osteoarthritis, the degenerative form of arthritis. As we age, the protective cartilage cushioning our joints gradually wears down. This process is partly due to decades of mechanical stress and partly due to biological changes in cartilage composition. After age 50, the incidence of osteoarthritis increases dramatically. By age 65, more than half of all adults show evidence of osteoarthritis in at least one joint, though not everyone experiences symptoms. Cartilage is remarkable tissue. It's strong yet flexible, allowing smooth joint movement while absorbing shock. However, cartilage has no blood supply, which means it heals very slowly and has limited capacity for self-repair. With age, several changes occur. Young, healthy cartilage contains about 80% water. As we age, cartilage loses water content, becoming less elastic and more prone to damage. Proteoglycans, molecules that help cartilage retain water and maintain its structure, decline in production with age, weakening cartilage integrity. Every movement creates microscopic tears in cartilage. Over decades, this cumulative damage exceeds the body's ability to repair it. Chondrocytes, the cells that maintain cartilage, become less active with age. They produce less collagen and proteoglycans, further compromising cartilage quality. Free radical damage accumulates over time, damaging cartilage cells and the extracellular matrix. It's crucial to understand that biological aging of joints doesn't always match chronological age. Some 40-year-olds have joints resembling those of 70-year-olds, while some elderly individuals maintain remarkably healthy joints. Factors accelerating joint aging include physical inactivity, leading to weak supporting muscles, obesity increasing mechanical stress, previous joint injuries, repetitive occupational or recreational stress, poor nutrition lacking joint-supporting nutrients, and chronic inflammation from other health conditions. Hormonal changes, particularly in women during menopause, significantly impact arthritis risk. Estrogen has protective effects on joints and bones. When estrogen levels decline during menopause, women experience accelerated cartilage loss and increased inflammation, explaining why postmenopausal women have higher osteoarthritis rates than men of the same age. Joint injuries are a leading cause of arthritis, particularly in younger individuals. Post-traumatic arthritis can develop months or years after an injury. Even if the initial trauma appeared to heal completely, approximately 12% of all osteoarthritis cases are attributed to previous joint injuries. Athletes and people with physically demanding occupations face particularly high risk. When a joint suffers trauma, whether from a sports injury, car accident, fall, or any other incident, several damaging processes begin. The injury may cause immediate cartilage damage through cracks, tears, or loss of cartilage tissue. Unlike skin or bone, cartilage cannot fully regenerate. Even after healing, the joint may not function exactly as before. Ligament damage, for instance, can create joint instability, causing abnormal movement patterns that accelerate wear. Injury triggers an inflammatory response. Sometimes this inflammation doesn't fully resolve, creating a chronic low-grade inflammatory state that gradually degrades cartilage. Impact can damage the bone beneath the cartilage. These bone bruises may not be visible on standard X-rays, but can alter the joint's structural integrity. The body's healing process creates scar tissue, which is less flexible than original tissue. This can restrict joint movement and create stress points. ACL tears, meniscus damage, and fractures are strongly associated with early-onset knee arthritis. Studies show that 50% of people with ACL injuries develop knee arthritis within 10-20 years. Severe ankle sprains, especially repeated ones, can lead to chronic instability and eventual arthritis. Recurrent shoulder dislocations damage the joint capsule and cartilage, increasing arthritis risk. Fractures involving joint surfaces often lead to post-traumatic arthritis, particularly if bone fragments don't heal in perfect alignment. Compression fractures or severe whiplash can trigger degenerative changes in spinal joints. The risk of post-traumatic arthritis can be reduced through immediate and appropriate treatment of joint injuries. Complete rehabilitation before returning to activities, strengthening muscles around previously injured joints, using protective equipment during high-risk activities, maintaining healthy weight to reduce stress on healing joints, and following through with physical therapy recommendations. Obesity is one of the most significant modifiable risk factors for arthritis, particularly osteoarthritis. The relationship between excess weight and joint disease is so strong that weight loss is considered one of the most effective interventions for preventing and managing osteoarthritis. Being overweight or obese increases your risk of developing knee osteoarthritis by 4 to 5 times. Even modest weight gain in early adulthood significantly increases lifetime arthritis risk. The most obvious way obesity contributes to arthritis is through mechanical stress. Every pound of excess weight adds approximately 4 pounds of pressure on knee joints during walking. If you're 10 pounds overweight, your knees experience an extra 40 pounds of force with each step. Consider that the average person takes 5,000 to 7,000 steps daily. This means weight-bearing joints like knees, hips, ankles, and the spine endure millions of additional pounds of cumulative stress annually when carrying excess weight. This constant overload accelerates cartilage breakdown. The cartilage literally gets compressed, crushed, and worn away faster than it can repair itself. Over time, this leads to painful bone-on-bone contact characteristic of advanced osteoarthritis. Beyond mechanical stress, obesity contributes to arthritis through metabolic and inflammatory pathways. This explains why overweight individuals also develop higher rates of osteoarthritis in non-weight-bearing joints like hands, where mechanical stress alone cannot explain the connection. Fat tissue, particularly visceral fat around organs, is metabolically active. It produces inflammatory molecules called adipokines and cytokines, including interleukin-6 and tumor necrosis factor alpha. These substances circulate throughout the body, creating systemic inflammation that damages cartilage and other joint tissues. Leptin, a hormone produced by fat cells, is elevated in obese individuals. While leptin regulates appetite, it also affects cartilage metabolism and promotes cartilage breakdown when present in excess. Obesity often occurs alongside metabolic syndrome, a cluster of conditions including high blood pressure, high blood sugar, abnormal cholesterol levels, and insulin resistance. Each component of metabolic syndrome independently contributes to arthritis risk. Insulin resistance impairs the body's ability to regulate inflammation and affects cartilage cell function. Abnormal cholesterol and triglyceride levels contribute to joint inflammation. Hypertension is associated with increased inflammation and may affect blood flow to joints. High blood sugar can cause advanced glycation end products that stiffen cartilage and make it more brittle. The encouraging aspect of obesity-related arthritis is that weight loss can significantly reduce risk and improve symptoms. Studies show that losing just 5% of body weight can reduce arthritis pain by 20–30%. A 10-pound weight loss reduces knee load by 40 pounds per step. Weight loss slows arthritis progression and may prevent some cases entirely. Combined with exercise, weight loss can improve function comparably to some medications. Autoimmune forms of arthritis occur when the immune system mistakenly attacks healthy joint tissues. Unlike osteoarthritis, which results from mechanical wear and tear, autoimmune arthritis involves active immune-mediated destruction of joints. Rheumatoid arthritis is the most common autoimmune arthritis, affecting approximately 1% of the global population. Other autoimmune conditions causing arthritis include lupus, psoriatic arthritis, and ankylosing spondylitis. In autoimmune arthritis, immune cells infiltrate the synovium, the membrane-lining joints. These immune cells release inflammatory chemicals that cause synovial inflammation. The joint lining becomes thick and inflamed, producing excess fluid that causes swelling and pain. Inflammatory enzymes break down cartilage at an accelerated rate. In severe cases, inflammation erodes bone itself, causing permanent deformities. Because it's a systemic disease, autoimmune arthritis can affect organs beyond joints, including eyes, lungs, heart, and blood vessels. While genetic predisposition plays a significant role, various environmental triggers can activate autoimmune responses. Certain viral and bacterial infections may trigger autoimmune arthritis in genetically susceptible individuals. The immune system may confuse joint proteins with microbial proteins, leading to cross-reactive attacks. Tobacco use is the strongest environmental risk factor for rheumatoid arthritis. Smokers are twice as likely to develop RA, and smoking worsens disease severity. The higher prevalence of autoimmune arthritis in women suggests hormonal influences. Pregnancy, childbirth, and menopause can all trigger or modify autoimmune arthritis. Gut bacteria composition influences immune system function. Dysbiosis, or unhealthy gut bacterial balance, has been linked to increased autoimmune arthritis risk. Chronic psychological stress can dysregulate immune function, potentially triggering or worsening autoimmune conditions. Exposure to silica dust, asbestos, and certain organic solvents has been associated with increased autoimmune arthritis risk. In autoimmune arthritis, inflammatory mediators create a self-perpetuating cycle. T cells and B cells infiltrate joint tissues. These cells release pro-inflammatory cytokines. Cytokines recruit more immune cells and activate cells that break down cartilage. Joint damage releases more antigens, perpetuating immune activation. Chronic inflammation causes pain, swelling, stiffness, and eventually joint destruction. This cycle explains why early intervention with immune-modifying drugs is crucial for autoimmune arthritis. Breaking the inflammatory cycle early can prevent irreversible joint damage. Even non-autoimmune conditions characterized by chronic inflammation can increase arthritis risk. Long-term infections like hepatitis C and Lyme disease can trigger inflammatory arthritis. Crohn's disease and ulcerative colitis are associated with specific forms of arthritis affecting joints and spine. Chronic stress and depression elevate inflammatory markers throughout the body, potentially accelerating joint degeneration. Arthritis rarely results from a single cause. Instead, it typically develops through the interaction of multiple factors. A person with genetic predisposition might never develop arthritis with a healthy lifestyle, while someone with no family history might develop severe arthritis after a significant injury combined with obesity. Understanding these 5 major causes genetic predisposition, age-related changes, joint injuries, obesity, and autoimmune conditions, empowers us to take control of our joint health. While we cannot change our genetics or reverse aging, we can maintain healthy body weight through diet and exercise, prevent injuries through proper technique and safety equipment, seek prompt treatment for joint injuries, and manage inflammatory conditions aggressively. We can stay physically active to maintain joint function and supporting muscle strength. Eat an anti-inflammatory diet rich in omega-3 fatty acids, fruits and vegetables, avoid smoking and limit alcohol consumption, and manage stress through mindfulness, adequate sleep, and relaxation techniques. Early recognition of risk factors allows for preventive measures that can delay or even prevent arthritis development. For those already diagnosed, understanding causes helps in making informed decisions about treatment and lifestyle modifications. Arthritis research continues to advance, offering hope for better prevention strategies and more effective treatments. By understanding what causes arthritis, we take the first step toward protecting our joints and maintaining mobility and quality of life throughout our years.